Hi, welcome to my channel. Continuing the playlist on information for parents in the NICU. In this topic, I will be discussing important information that you should be aware when your baby is discharged from the NICU. The NICU admission as well as the stay are very stressful for all families. Obviously, your baby will have a varied course depending on the reason for the admission. So if it's a very premature baby, for example, they stay for a few months. 23-weeker, for example, may stay for 3 to 4 months and sometimes even longer, while a full-term baby who is admitted for just breathing difficulty may stay for 2 to 3 days, sometimes a week or so. So the duration of stay varies a lot, but in any case, it's very stressful for the family. And usually they establish a good rapport with the NICU team and the managing physicians and the nurses, who will keep them updated on the baby's progress as well as the expected time of discharge. Most parents are very keen to discharge at the earliest possible, but some parents are very cautious and anxious about how they would cope after discharge. So both sides have to be supported. In terms of timing of discharge, one advice I would give to all parents is not to push the physicians, because there are criteria which we use, there are safety concerns which we have to address. So please follow the physician advice. And obviously what I have listed here is a guide. In the developed countries, in the developing world, things are different in terms of economics, in terms of cost of stay, in terms of family support, and obviously these criteria are the safest, but depending on the circumstances, you may be discharged earlier in the developing world. So the preferred weight of 1.8 kilos and above, maturity of 35 weeks gestation and above. The maturity is very important because the risk of aspiration or choking is high if the baby is more premature. And maturity progresses, so a baby is better feeder at 36 weeks and 37 weeks than they are at 35 weeks. So each week advancing matures. So the parents have to be cautious even after discharge. They shouldn't take it for granted that the baby is absolutely normal. They still have to be cautious for 2 to 3 weeks after discharge. There should be no significant concerns like drops in oxygen saturation, what we call as desaturation, or there should not be any other concerns. The baby should have been off caffeine for a period of time as well. The baby should be able to maintain temperature in a cot with a normal level of clothing. There should be ability to complete suck feeds without desaturation episodes or choking episodes. The baby should demonstrate weight gain. Again, there are a few tips on how to encourage the baby to complete suck feeds. We move to what is called semi-demand or ad-lib feeds to encourage the baby to be a little more awake when they are sucking. The parents should be involved in the care and they should be comfortable with the process as well. There is usually a discharge checklist that most of us follow, and we should have advice on the feeding pattern, the timing of the feeds, and the position. One important thing that the parent should be aware is that the timing of the feeds, better to follow the pattern that you're following in the NICU soon after discharge, because babies may look more hungry. You may overinterpret the hunger cues. So if you overfeed the baby, these are high-risk babies for reflux, and they may end up having problems related to reflux. So try to gradually increase the feed volume. You would have a plan put in place for that as well. The doctor discharging you usually would have given an advice on medications to be given at home, and there would be follow-up tests and appointments that you need to be very clear about, not to miss them, because these are very important. For example, the ophthalmology follow-up in a premature baby for retinopathy screening. We might need echocardiography follow-up for heart screening, and we may also have a repeat hearing test if the baby failed hearing in the beginning. So you may have other tests done as well. We have vaccination due, which is given in your booklet usually, and parents should have basic life support training, and use of car seat should be encouraged as well. So when you go home, the room temperature should be 22 to 24 degrees or so, and it's appropriate in most cases. We should assess if the baby is adequately covered and clothed, and you can increase the room temperature soon after bathing or handling for nappy change. For example, a baby's hands and feet are blue. You can hold the baby's skin to skin for a few minutes to rewarm, and then adjust the clothing level as needed. If it keeps happening that the baby is cold, you may need to make the room warmer as well. You don't need to measure the temperature unless it's necessary and you're worried, and have a thermometer handy in any case. When the baby is ex-premature or still the weight is under 2.5 kilos, it's better to delay bathing. If you wish to bathe, don't bathe the baby every day. You can do it once in 3 days or so, till the baby is close to 3 kilos or so. After 3 kilos, you can start treating the baby more like a normal baby. For the same period, we also advise you not to go out much and take precautions similar to what we do in the NICU to reduce the risk of infection. Consider using the emollients on wet skin if any areas of dry skin are there, and take care of the nappy area. You can review the earlier videos on skin care to get more advice on this. So regarding the feeding, we already discussed briefly. To follow the feeding advice, you may need additives in the feed like fortifier to continue longer, or a special formula may be needed called post-discharge formula if your baby needs some formula support. So follow the instructions on that as well. You better involve yourself in the feeding of your baby a few days before discharge, and so you're aware of when to watch the baby, because you won't have a monitor at home. You need to watch the cues of the baby while swallowing to be comfortable. If you think the baby is not swallowing, you need to take the bottle out, burp the baby, and wait for a few minutes before you feed again. It's better to maintain a 2 to 4 hour feeding pattern and avoid overfeeding. Don't increase the volume too quickly. Discuss with the doctor about how you can increase the feeds after discharge. Too much of feeding may lead to vomiting and reflux causes acidity related issues and excessive crying as well. So it's a cycle where you think the baby is hungry and you feed more, and that may end up causing more problems. You may consider head end elevation like we follow in most NICUs to reduce the risk of reflux in the first month or so. Use a car seat for positioning, as I have discussed in the video on positioning as well. We have to learn to give the vitamin drops, and it's important to remember that you don't give it directly in the back of the mouth so the baby doesn't choke. You have to put it on the side of the cheek so the baby knows something is coming and they start swallowing, and drop it in a slow way and be ready to stop dropping if you think the baby is not swallowing or choking. We have videos on colic and reflex, and most of these problems start once a baby goes home. In the hospital, we don't see it for some reason, but once they go home, the parents start complaining about it. Don't panic, these are normal changes, and take the measures I discussed earlier for reducing reflux, and follow the vaccine schedule given to you as well. Usually there is a demonstration before you go home by the NICU team on basic life support. You can involve other family members who will be looking after the baby as well, and there are videos on this channel as well for teaching you the basic life support and what to do if there is choking. We should also be aware of the sudden infant death risk factors, and you can review the video on that as well. Home monitors are not advised in the majority of the babies because it may cause unnecessary anxiety, and there are no evidence-based information to say it helps. But you should be careful with the routine handling and the sudden infant death reduction measures like not smoking, keeping the baby on the back to sleep, not having anything soft which can suffocate the baby. These are very important. Car seats are legally mandated and baby should be strapped. They are rear facing car seats, and you should not put the car seat in the front of the car. There is a video on car seats which you can refer to as well. So get the car seat in advance, and in very small babies we do a car seat challenge sometimes, and you may consider a car bed if the baby does not cope with the car seat. The follow-up will include pediatric clinic follow-up, which is for the routine growth and development and vaccination. The pediatrician usually clubs as the person who coordinates the care of the baby. If your baby is high risk for neurodevelopmental problems like a premature baby or a baby who had birth asphyxia, it's very important to follow up in neurodevelopment clinic as well. Here it's usually multidisciplinary input. Physiotherapy and occupational therapy are already involved usually before you go home, and they continue to follow up the baby in liaison with the neurodevelopmental pediatrician or the neurologist. Other specialist follow-ups, as I mentioned earlier, should be arranged as applicable, and the hearing test may be needed again. There may be a need for hip screening if the baby was breech, and further follow-up as needed. So this is not a summary of all the problems. There's just a few concerns you may face at discharge. So be aware of this, and I would encourage you to continue to monitor as well. I hope this is helpful, and please do share. Thank you.